Hello ladies, my name is Jaylene Sims. Thank you for tuning in to the Love Your Life series. Today we're going to talk about diabetes. The lesson is entitled, Girls Fight Diabetes. So the purpose of this lesson is to teach the definition and types of diabetes, to discuss the signs and symptoms of diabetes and how to care for and manage it. We'll discuss risk factors and complication of diabetes. And last, we'll talk about ways to prevent diabetes. So what is diabetes, or as some people call it, the sugar? Diabetes is defined as having too much sugar or glucose in your blood. Your glucose can be increased by foods such as carbohydrates or starchy foods, stress, and hormones in the body. Your glucose can be decreased by a hormone in the body called insulin, which we'll discuss more, and medications. So insulin. Insulin is the hormone in the body that helps us decrease the amount of sugar in our blood. We can consider it the key that unlocks the cells and allows the glucose to go in and therefore help us provide energy for our body to work like it's supposed to. Insulin is released from the pancreas. So as you were probably wondering, what is the pancreas? The pancreas is an organ that sits in our upper stomach area or our abdominal cavity. It's very, very important for controlling our blood sugar. It's what secretes the hormone insulin. So here are the different types of diabetes. There's a couple more actually, but we're just going to discuss type 1 and type 2. So type 1 is mainly seen in younger people. It's caused by the pancreas being destroyed and not being able to make insulin the way that it's supposed to. It's an autoimmune disorder sometimes. Auto meaning self and immune meaning the cells that actually attack different foreign bodies that come in. So it's thought that the pancreas is in a foreign body when it really isn't. So our cells actually attack it. Type 2 diabetes is mainly seen in adults, but because of our obesity crisis and the health of our nation, we're starting to see it more in younger children. The cause is the pancreas doesn't make enough insulin, or it's when our body doesn't respond to the insulin that is made. And it's thought that extra fat in our bodies can cause the cells not to respond the way it's supposed to. So that brings us to prediabetes. Prediabetes is when your blood sugar is high, but it's not high enough for you to be diagnosed with diabetes. Now, when you're in this state, you can actually prevent diabetes from onsetting. So what can you do? You can try a low-carb or starch diet. You can also exercise and keep your weight down. Those are things that you can do to help you prevent diabetes before you get it. Here are the different signs of diabetes. Sometimes we don't actually notice that our blood sugar is very high, so these are things that you can kind of look out for to let you know if you should be going to see your doctor. Vision changes, such as blurry vision. Hunger. Sometimes we feel hungry because, like I said, the insulin is not working the way it's supposed to, so the glucose doesn't go into the cells to help us provide energy, so therefore we feel like we're really hungry, or as a couple bullet points say down here, we feel tired or fatigued. Another sign would be thirst, extreme thirst. You're really thirsty because you're going to the restroom quite a bit and you're urinating a lot of the fluids that you have in your bodies, and therefore it's making you feel really thirsty. And sometimes you'll have weight changes. So what are some risk factors for diabetes? High blood sugar is one of them, and that's defined as a blood pressure of greater than 140/90. Also, being overweight, and as we kind of alluded to before, increased amount of fat in your body makes it more difficult for the cells in the body to actually respond to the insulin that's in your blood. We call this insulin resistance. Another risk factor is being sedentary or being physically inactive. The last one I'll mention is a family history of diabetes. So if you have a mother or a father, grandparents who have it now or had it, you're at a higher risk for developing diabetes. So then it's all the more important for you to engage in preventative measures, which we'll talk about a little later. So here are some of the diabetes complications. Heart disease is one of them, or cardiovascular disease. A lot of times when people have diabetes, they have a greater chance for developing heart attacks, enlarged hearts, or heart failure. They also have a greater chance for developing strokes, and a stroke is just when the blood flow to the brain stops for a short period of time. Also, peripheral neuropathy or damage to the nerves. Normally, it's in the legs or the arms or fingers, toes, things like that. You may feel numbness or tingling in the hands or feet or loss of sensation. And lots of times this leads to limb amputations or a loss of a limb. This is usually caused by decreased blood flow to the area or sometimes increased amount of sugar in that area, which causes the nerves to become damaged. You may also have lots of cavities in your teeth because when you have diabetes, your immune system is kind of compromised, so it can't fight off the different microbes in your body the way that it normally would. So here are a few more diabetes complications. Vision changes or diabetic retinopathy, and this is due to the increased amount of sugar in your bloodstream causing damage to the nerves, as we kind of discussed before, and it can also cause damage to the vessels. Nephropathy, meaning kidney damage, and is actually one of the number one causes of kidney damage. And this is also due to the increased sugar causing your kidneys to be overworked, and it also causes the sugar and the protein to spill into your urine. It can also cause sexual dysfunction. The decreased circulation or blood flow to the genital area can cause decreased lubrication and decreased sexual drive, or libido is the medical term for that. Decreased effectiveness of the immune system, and that's how we talked about before with the cavities in your teeth. You're more likely to get infections, and it also takes longer for the body to heal from wounds and ulcers. This picture here just demonstrates all the things we just talked about with the cerebral vascular disease or strokes, the retinopathy or the eye changes, coronary heart disease or heart attacks, things like that, nephropathy with the kidneys, neuropathy with the amputations, the ulcers and the amputations for a diabetic foot, decreased immune system, things like that. So here are some things that you can do if you have diabetes, how to care for it, or if you know someone who has diabetes. These are some things that you can actually teach them. These are called the ABCs of diabetes care. Things that you should have checked regularly if you have diabetes. So the A stands for hemoglobin A1C, B stands for blood pressure, and C stands for cholesterol. We'll talk about each of these separately now. So the hemoglobin A1C, it measures the average amount of glucose or sugar that you've had in your blood for the past 2 to 3 months. It lets your doctor know how well your diabetes is being controlled, which is excellent. Your target, per the American Diabetes Association, is less than 7%. However, if you can get it lower, it's even better. If your A1C is greater than 6.5% when you're being screened, then that's how you would actually be diagnosed with diabetes. You should have that checked at least 2 times a year, and if your diabetes is not well controlled, then you'll probably have it checked even more. So you can improve your A1C by exercise, working on your eating habits, and making sure you take your medications on schedule as prescribed by your physician. So here's the blood pressure component. A normal blood pressure is below 120 over 80. If you're on medication, we want it to be below 130 over 80. And what do those numbers mean? So the top number, or the systolic, is the pressure when your heart is pumping, and the diastolic, or the bottom number, is the pressure in the heart when it's relaxing. So why is blood pressure a concern? Well, when you have high blood pressure, it makes your heart have to work hard to pump the same amount of blood through your body. It's kind of like running up a hill. In order for you to run the same speed, you have to work harder when you're running up a hill opposed to on flat ground. High blood pressure also increases your chance for heart failure, heart attacks, strokes, enlarged heart, and hardened blood vessels, or atherosclerosis. How do you improve your blood pressure? You can try a low sodium diet or a low salt diet. You can increase the amount of fruit and vegetables that you intake. You can work on your stress management. You can exercise, and something that always works for me is laughter. I love to laugh, and it definitely decreases my blood pressure because it's a part of my stress management. So cholesterol is the C component. What is cholesterol? Well, it comes from the fat that we eat. Now, it's good to have some fat because it provides the most energy for your body than the carbs or the proteins or the other type of molecules that we eat. So it's good to have the fat. It's just that you don't want to have too much. So your total amount of cholesterol is just how much fat you have in your body. You want that to be under 200. Now your triglycerides represents the fat that you've eaten over a longer period of time, and your target for that is less than 150. So now let's discuss that good and bad cholesterol. Lots of times you hear your doctors talking about it or you hear it on commercials. Now let's talk about what it means. Your HDL cholesterol is your good cholesterol. I say H stands for heaven. So that's my good cholesterol. It prevents your cholesterol plaques from building up in the arteries. It actually is protective. So we want that to be high, greater than 40 or 50. Your LDL cholesterol is your bad cholesterol, or I call it the lousy cholesterol. Now this causes plaques to build up in the artery, which decreases your blood flow to different areas of the body. So as you can imagine, you want this to be low. Now the target actually depends on a lot of different risk factors. We actually won't go into that. We'll just talk about if you have diabetes, we really want that target to be less than 100. So how do you prevent diabetes or care for your diabetes? This is just a little bit more past the ABCs of diabetes care. So diet, exercise, and weight manage. Those are probably some of the most effective ways to prevent diabetes. Now, stress management, such as yoga or meditation. A lot of people like to go to church and pray, having family time or friend time, or like I like to say, me time, just to pamper myself. Regular doctor visits. This helps you catch problems early when they're actually treatable or reversible. So I would encourage everyone to make sure you go to regular doctor's visits and make sure you get your screenings. And sometimes if you're in Walmart and you see someone doing some screenings, go ahead and take the time to stop and let them pick up things early. Medications. Know the names of your medications. That way, if you happen to go to the emergency room or you happen to switch doctors, they'll be able to keep it managed for you because you know the names of your medications and the dosages. Another thing about the medications is to take them on schedule as prescribed by your doctor. Make sure you do that because that will definitely help you either prevent complications or it'll help you care for your diabetes in the most effective way. Foot care is also important. Make sure you look at your feet every single day. If you have a problem looking at the bottom of your feet, you can also take a mirror and just set it towards the bottom of your feet, and you can look in the mirror and see the bottom of your feet. Make sure you have an annual diabetic foot exam by your doctor. Always try to wear socks and shoes when you go outside because sometimes, as we talked about that neuropathy, sometimes you may not feel when your feet are really cold or really hot, and it'll cause you to have sores. And then make sure you keep your feet clean and moisturized. If you don't keep them moisturized, sometimes they'll crack, and sometimes that'll give an avenue for different microbes to crawl into the cracks and cause infections. And as we said, sometimes your immune system might be a little bit compromised, so we really want you not to have to get infections that can be preventable. And lastly, make sure you have your annual eye exams. So here's a little bit about the diabetic diet. I really like this. This is not necessarily something that only diabetic patients should use. I actually use this for myself because it provides me with a really good overall plate once I make it like this. So it's called the plate method. Half of your plate should be non-starchy vegetables and fruit. So what is non-starchy vegetable? That's like greens, green beans, carrots, broccoli, salad, cauliflower, spinach, cucumbers, things like that. A quarter of your plate should consist of protein. Now that would be your chicken, beef, pork, turkey, fish, beans. When you have those proteins, try to have them baked, grilled, broiled, or boiled. That way you don't get extra fat from when you have your fried foods. Now, one thing to keep in mind is If you have beans for your protein, beans are also a starch, so you'll have to take away from the other quarter of the plate, which consists of starchy foods. Now, starchy vegetables and grains can actually go there. So your starchy vegetables would be things like your peas and your corn and your potatoes, and then your grains would be, of course, your pasta, rice, and dinner rolls. So here are just a few more tips. Do away with the salt. Of course, that's going to help you with your blood pressure. Try to do away with the soda and sweet tea because those are just liquid calories. And for me, I say if I'm going to have calories, I prefer to have it in my protein, starches, fruit, and vegetables opposed to something that's a liquid that's not going to fill me up. And then lastly, try to drink at least 8 8-ounce glasses of water a day. And if you are a little heavier, then you should try to drink a little bit more than that. The next thing, exercise. Get moving. You can exercise in the mall, around the neighborhood, in the park, in the gym, anywhere you feel comfortable and safe. And if you haven't been working out, try to just set some goals just so you can get started. Start off with maybe 10 minutes of continuous exercise, then go to 15, and then work your way up to at least 30 minutes of continuous exercise 3 to 5 days out of the week. Here are a couple different types of exercise. You can walk, dance. I love doing Zumba, so that's why I put that there. You can also run. You can do some weight training. Also, just to keep you active, you can use the stairs at your job or whenever you go out somewhere when there's stairs available. You can also park far when you're going to the mall or go to the grocery store and just walk in instead of parking in that first parking spot you see right at the front of the store. Exercising with your girlfriends or with your guy friends, that's always going to help motivate you to go hard. So I would encourage that as well. So now we've gotten to the end of this presentation, and here's the charge that I like to give everyone. Each one, teach one. You now know more about diabetes, and it's your responsibility to teach the next person what you learned today. It's your responsibility. Go ahead and go forward. Do you have any questions or want copies of the information today? If so, feel free to email me at jaysloveyourlife@yahoo.com. You can also go to the Facebook page. It's called Jay's Love Your Life Foundation. Feel free to like that page, and then you'll see different updates on educational topics that we have available. Another thing you can do if you have questions is to visit your doctor. This information in this presentation should not be substituted for the advice that you can get from your physician. Lastly, the resources that I used was One American Diabetes Association, and then of course for the pictures, I just go to Google and I find what I want and I put it in the presentation. So those are not made by me. Thank you for tuning in to the Love Your Life series. I will talk to you again next time.